Welcome to the American Association of Critical Care Nurses Voices in Nursing podcast, exploring critical care nursing through meaningful and inspiring conversations. This episode is brought to you by AACN's Clinical Scene Investigator Academy, providing the knowledge, skills, and tools to lead innovation, with information available at www.aacn.org/CSIAACN. Now here are your hosts, AACN's Chief Clinical Officer, Dr. Vicki Good, and Clinical Practice Specialist, Andrea Schmidt.
Hi, welcome to the Voices in Nursing podcast. This is Andrea Schmidt, one of AACN's Clinical Practice Specialists, and I'm joined by my colleague, AACN's Content Strategist, Brandy Pack.
Hi, everybody. I look so excited to interview our guest today.
Me too. And so to get started, I wanted to share a couple of thoughts. So many healthcare systems have a goal to become a high reliability organization. And so for our listeners who may not know, a high reliability organization, often referred to as an HRO, is an organization that has deeply rooted culture of safety and consistently achieves a high quality of care, reduces errors, and utilizes practice to understand the root cause of problems. This is very difficult, if not impossible, to achieve without the involvement and voices of direct care nurses. Today's guest has succeeded in involving direct care nurses at every level and every shift in her organization. We are so excited to welcome Dr. Holly Muller, the Chief Nursing Officer for Presbyterian Healthcare Services in New Mexico. Holly, would you start off by telling us a little bit about yourself and your healthcare system?
Yes, thank you. And one, I'm just thrilled to be with everybody today. So thank you for the opportunity. I work here in Presbyterian Healthcare Services in Albuquerque, New Mexico. It is a 9-hospital system with multiple clinics throughout the state. I think it's important to pause and just talk about the state and our footprint first. In New Mexico, I don't know if you know this, but it's the 5th largest state in the nation, but yet it's lightly populated because for the majority of our state is rural. And Presbyterian Healthcare Services cares for about 50% of those citizens as one of the primary healthcare service providers within the state. It's interesting when you think about the challenges of caring for a rural community. As nurses, you understand the social determinants of health and the challenges in any patient population. But in trying to deliver care and to do that with the most engagement from our nurses and our entire healthcare team takes focus, takes structure, takes a lot of support to be able to do that. And, we have a large Native American population as well. So that's who we are and who we serve. I work as the Senior Vice President and the System Chief Nursing Officer for this health system, and really consider it a privilege to be able to help lead nursing practice and support patient care delivery for our citizens in New Mexico.
That's great. Thank you for the background on the state. I think that's nice to put that in perspective and kind of understand a little bit about it, because I think it may lead us into some of the challenges that you face as well. So, Holly, as with many healthcare systems, the COVID-19 pandemic took a toll on your nursing workforce, and you really saw the need to develop leadership at all levels of your healthcare system. So could you share with our listeners how you developed 2 system-wide shared governance council and the role that each council took?
I really love that question because, one, it's probably a situation that every nurse across the country will relate to. When I looked at the effect of the pandemic, and probably similar for many people in this audience, it disrupted many of the processes that we had in place to be able to provide direct patient care. So a lot of rebuilding was required. And that rebuilding for me here at this location started with our nurse leaders, because I wanted to make sure that they had all the knowledge, competencies, skill set, and resources they needed to be able to lead patient care delivery as we were in that rebuilding phase. And then same for our direct care nurses going through a similar experience. So starting at that foundational level, doing some development with our nurse leaders to make sure they were well positioned to move, to really have a future focused mindset in leading practice post the pandemic was really important. Structurally, we needed to have a process in place to be able to do that work together and to be aligned. So I instituted an enterprise-wide nursing leadership council that I am the chair of, and then ensured that our chief nurses, our directors of nursing, important leaders in home health, care management, all the different places that we come together as nurses and leaders to be able to guide patient care delivery. So I assembled that council and brought all of those individuals together and began that foundational process of being aligned. We have 9 hospitals and a multitude of clinics throughout this state, as well as home care and other services that we provide. So having representatives on this council to be able to speak to the acute and the post-acute and the ambulatory aspects of service was really important to make sure that we were understanding the issues and making the right decisions together. So that council was formulated. It meets monthly, and I'm really proud to say that over the last year and a half, I was able to bring direct care nurses into this council. When I think about the governance responsibilities across the enterprise and engaging these wonderful, talented team members to do this work, it is critical to have direct care nurses in that process. So we just celebrated, we're coming up on 2 years shortly of having direct care nurses be full voting members of this council and very engaged in the practice of nursing, our standards of care, and how we deliver healthcare outcomes to our patients.
Holly, that is amazing. I love bringing in direct care nurses. I think that's great to get those nurses that are point of care, things like that, to get their feedback and things like that. Can you tell me the difference between the system-wide leadership nursing council and then the nursing leadership council?
Mm-hmm. So the system-wide nursing leadership council is the governance council that I lead across the health system. But then this structure cascades throughout the organization. And I'm sure we can take a moment to talk about reigniting professional governance as a methodology to be able to help these nurses be successful. But when I think about the structure, then we need to understand how that cascades into both the ambulatory and the hospital level with these nurse representatives at that point of service.
Like, how many people? Now I'm so interested. How many people are on the system-wide one that you chair?
Well, now that we added the direct care nurses, 50% of the membership are direct care nurses who also are accountable to lead professional governance at their site, their specific location. So now it's about a little less than 50 people now. In our enterprise, we're an enterprise of 14,000 employees, once again, across 9 hospitals, ambulatory clinics, and other post-acute services. So that body is 50% what you would call formal leaders, such as chief nurses, directors of nursing. But I really believe every nurse is a leader. So now the composition is that 50-50 split between the traditional leaders that we started with and the direct care nurses that we brought into the fold.
Wonderful.
That's really great participation. And I think that's going to segue really nicely into my next question. But before that, I was wondering if you could clarify something for our listeners, especially those who are direct care nurses. Can you explain the term enterprise versus organization? Is that the same thing?
When I use the term enterprise, I'm talking about the entire Presbyterian Healthcare Services.
Okay, great.
So everywhere a nurse is.
Got it.
Mm-hmm.
So I think that we're probably all familiar with this problem where we often hear from, the community, shared governance is great. but we can't get our nurses to engage. You know, it's difficult for certain individuals to get there depending on the shift that they work. So I can't imagine that those challenges were any different in your organization. So, but what challenges did you face with engaging nurses in the council work, and how did you overcome them?
I think that's a great question. You know, when I grew up in nursing, shared governance was the model. We know through publications that Tim Porter Grady has had over the last many years, he's helped us to understand that transition to professional governance. And that also that even calls into play how important it is to have interprofessional team members be included in that process and how nursing leads across the entire healthcare team. So I love how he evolved that concept. So how do you make it happen? First of all, you need to set the expectation. So that comes to leadership expectations. Who do you want your nurses to be in an organization? How will that have value to them? How will it elevate their voice? So how I got people interested in it is I had that conversation. I started talking about elevating the voice of the nurse. We had started, I actually want to pause and talk about the nursing strategic plan because this is the beginning part of the story. So as we got the Nursing Leadership Council activated, we needed a strategic plan to help nursing be able to guide the work forward. We already had an enterprise system strategy and plan for that, but nursing didn't have one at that time. So I actually tapped a really great article from Marla Weston. She published it right at the time that I entered the organization back in 2022. And she talked about nursing leadership and this challenge post the pandemic. And everything that Marla wrote about that article was what I was thinking in my head. And I used that as a foundation to start the conversation with our Nursing Leadership Council and also nurses that I already had met in direct care that were starting to pop up as leaders. I could just see their talent as I was rounding and engaging with them in each of the hospitals and the clinics. So I started that conversation. We developed a nursing strategic plan with the input of the council and began to develop a roadmap around 7 pillars of work: leadership, regulatory compliance, of course, quality and safety, developing a sustainable workforce, how do we elevate technology and nursing practice, well-being, and then how do we engage with the community? And so using Marla's article, I put concepts together to help the group begin to define that work. And then we walked out with what our projects and tactics would be in order to enable the strategic imperatives around those 7 pillars of work. And that became our roadmap. At the same time, we didn't have a nursing vision. Through some meeting activity, we developed a nursing vision that basically talked about that the practice and the art and the science of nursing matters here, and that trust, caring, and excellence would be our pillars of focus for every nurse, every patient, every time. So now we had a vision, we had a strategic plan. And what we had is a conversation that we started about who do we want to be as nurses at Presbyterian? How do we want to care for patients? What do we want our impact to be? And I started talking about the voice of the nurse, elevating the voice of the nurse. And I made it very clear that as a chief nursing officer, this was not my decision. This was our decision. And everybody needed to put their fingerprints on this work. So just started to tap staff nurses that I had met along the way, start conversations. And at one of our hospitals, they had some seeds of professional governance that were still alive post-pandemic. And I started where the most interest was. And actually to this day, the first nurse I met on my interview for Presbyterian was that nurse at that hospital that was the most engaged and the most interested in reactivating professional governance. It started there. And then that campus was the first one with that nurse and some of her coworkers to be able to get them get them to reactivate professional governance at their hospital and to get that work linked. And then from there, I partnered with them to start conversations with other nurses throughout the system. And now we had a coalition of interested individuals that kept raising their hand saying, I want to help, I want to be part of this, and I want to be involved in making decisions about our practice, and I want things to be better post-COVID. Because everyone realized they lost something in that process and they wanted to get it back. So we further defined the charter of the Nursing Leadership Council to start to speak to that work and how we were going to do it and what our primary objectives were. And one of the primary objectives of that Nursing Leadership Council was to ensure that nursing strategic plan came alive and that we could actually take those words and make that a reality in practice. I'm happy to say that 3 years later, because we are now in our last quarter of that strategic plan, every single strategic imperative, the projects and tactics and milestones that we identified that we wanted to work on, there were literally over 3 years, 56 projects or tactics that we identified quarter per quarter spread over 3 years in order to meet our goals and the improvement work we wanted to see on those 7 pillars. I can tell you that every single thing we put on that plan was developed and activated. Now, the lesson learned is by year 3, when you're trying to predict what you're going to do 3 years ago, did we have to make some modifications in year 3 on how we did that work? Yes, because the world keeps spinning and organizations change, and sometimes you might not have the infrastructure to do it in the way you thought you could do it 3 years ago. Ironically, just yesterday, I did a nursing summit. I do these 2 times a year with my entire Nursing Leadership Council, which includes the direct care nurses and other nurse leaders that we invite. And the purpose of this summit is to say, what did we accomplish and what are we going to do next? Part of our work yesterday was celebrating the accomplishments of everything we did together over the last 3 years and writing the draft of the 2026 Nursing Strategic Plan just yesterday. I am writing a 1-year strategic plan because we all know as we're experiencing healthcare right now, things are still very dynamic. And the degree of change is significant. So we made a decision that we agreed, we did very good foundational work on those 7 pillars that we talked about. And that in 2026, we were going to have a singular focus on quality, safety, and care experience. And that we felt that we could maintain and continue to nurture the foundation that we've built over the last few years, but that it was really critical that we make even more significant gains in our quality, safety, and care experience accountabilities for outcomes. So yesterday we walked out of that summit with the final draft of that plan. And through the Nursing Leadership Council over the next 2 months, we will polish that, refine it, make sure we didn't miss anything, and actually then develop how will we get that work done? What resources will we need? How will we accomplish that? So I couldn't be more excited about where we are. When I met a lot of these individuals several years ago, they were definitely engaged, but they didn't have the alignment that some of the structure in this process that I've spoke of, would enable them to be able to do that work. And we have a lot of enabling processes now, the vision statement, the nursing strategic plan. We have a lot of different things that we've accomplished that are those cornerstones and those building blocks that will allow us to be really successful over the next year in this work.
Holly, you have got to be proud of yourself. Like, this is truly amazing. Gives me chills of all the work and structure that you've put in and all of the people that you've brought together to make this happen. It's incredible. Incredible.
I appreciate that, but I have to tell you, it goes to the team, right? As leaders, we set the direction, we set the tone, we make sure we serve our teams, get barriers out of the way, and make sure that they have what they need to have a meaningful experience, to be a nurse and to lead this work. They did the work. Obviously, I have a lot of responsibility. That's part of the job when you sign up to be a chief nurse. But it's really exciting and inspiring when you see nurses be able to expand their scope of how they want to make a difference in patient care. I think that's the part I enjoy the most, is watching their journey, being a part of their journey, watching their journey, and helping them to grow their careers and make contributions. That's the real reward. And of course, our patients win, right?
Yes,
our patients
absolutely
win through that effort. But, throughout my career, I have just always loved nursing. I feel so much connection to purpose and being a nurse. And I've been really blessed to be able to be in different leadership positions across my career, with the goal that my role is service, it's influence, and it's trying to bring us all together to align all of our efforts in order to provide exceptional patient care, but also build great teams. Healthcare is fun. It's fun to be part of these teams and to do this work together. So,
especially if you're all working towards a common goal, and it sounds like that was really very key for all the work that has been done. One of the things that you did.
I can share one story. Yesterday at this summit that I spoke of, there was a poster that we hung up in the room that was done by this same nurse, who was the first nurse that I had met upon my interview, and was the first nurse to raise their hand and say, I want to rebuild professional governance. This is where she's been now leading professional governance for 3 years within her organization. She did a poster presentation that was accepted at the American Organization of Nurse Leaders Professional Governance Conference, and she just got to present that in San Antonio. I have goosebumps just telling you about this right now.
How exciting.
I've gotten to see her come full circle. And she's now at the point that she teases me, stop telling everybody. And I'm like, no, I'm going to keep telling everybody that will listen. But I made sure her poster was displayed in the summit yesterday with all the nurse leaders, and that she had a chance to talk about it. But just to see her be able to contribute at the level that she has, and that she got to be one of the presenters at the Professional Governance Council, I just could not have been more proud of her, and how she also then is now cascading evidence that she's put into practice and being able to share it with other nurses. I thought was pretty cool.
I think that's the one thing I took, one of the things I took from your story, about that it just takes one. It just took that one nurse and I think another thing is like tapping people on the shoulder, like, hey, you can do this. Some people think that they can't do it, but that's one nurse, and then tapping people on the shoulder saying, yes, you can. And like, let's do this together, I think is just phenomenal.
I love that you mentioned that, because I think all of us who are in formal leadership positions, we have a responsibility to use our time to personally mentor our teammates, our nurses in our teams. It takes all of us to be able to invest in our nurses and to help develop them and make the way for them to have those experiences. And yes, there's other work we need to do in the organization, but in my mind, that is the work. And at the end of the day, it creates great patient care too.
So you didn't sorry, I was wondering about the leadership prep though, because you didn't just appoint the nurses. Didn't you like prepare them to how to be on shared governance? Because it's a nice idea sometimes, but to actually learn how to do it, I'd love to learn more about that.
I love that you asked that question, because the first thing I had to do is privately sit down with my chief nurses and some of the other key leaders and have this conversation with them and help them to understand. They already saw me very visible in all the hospitals, very visible in the clinics, talking to the nurses, rounding on patients, and including them as well. So they already knew I was trying to really remain at that frontline level to understand what the experience of our nurses were, what they needed, what the possibilities were. But when I shared with them, this is what we're going to do next, and this is what it's going to look like, and that It's too important not to, to take this step. We must bring our direct care nurses into the Nursing Leadership Council. They must be part of the voice of how nursing is led going forward. And as a chief nurse, I refuse to continue to make decisions without their voice at the table. That's just, we're gonna change this model. So preparing them and having them have the psychological safety that we could do this and was a conversation we had to have. And I was really proud of them. It wasn't long before they were like, all right, we're ready. We feel prepared. We trust the process. And it really went beautifully. But then we had to prepare the nurses. So I had all the chief nurses and directors of nursing and such, identify who will be your leads at your site, because I need every hospital represented and I need ambulatory and, all the post-acute, I need everybody represented. And I said, and we came up with a structure. Okay, start with this many people and go help me find out who they are. So it took probably about a month, and we identified who these individuals were. And I said, okay, well, now we need to help them understand what their role is and have a conversation. So I personally met with the chief nurse or director of nursing with every single one of those nurses to first have a conversation with them, to also orient them to what the expectations were of the Nursing Leadership Council, our charter. Why do we exist? What will the direct care nurse role be? What are the accountabilities? Because this is a shared decision-making process, and with that comes accountability as well. So we had basically an orientation session that me and then their leader with these nurses had. And there was no exception, like that had to happen. So we did all that individual orientation, and then the summits that I talked about, before we put them in the council, there was a summit at that time. And part of the content that I reviewed at that summit was, again, what is professional governance? Why does it matter? And by the way, let me introduce you to our nurses that are now about to join the Nursing Leadership Council. That summit was the first experience those direct care nurses had together now as a new team, where they were now involved in the governance of nursing practice at the enterprise level. And then it was that following meeting after the summit, which was the first Nursing Leadership Council meeting, where our nurses joined us as new full voting members.
Now, we know that hospital finances are tight out there all along, but it sounds like you've definitely articulated the value of professional governance and things along that line. But how do you get around? I know sometimes at some hospitals, it was always a challenge of who's going to pay for this kind of thing, like who, which bucket is this going to come out of, But it sounds like a really great retention thing. So you would think, because these nurses have to be so excited, a really good retention driver.
It definitely is. The first year we didn't have a budget to be able to do this, and we just had to basically make it work. But it was important enough. We were moving forward, and we were going to do it anyway. But then I did create a number of hours in each of the nursing administration cost centers to have X number of hours per month per nurse, so that they could have some dedicated time within their hours, and it was structured in the nursing administration cost centers to be able to support this. And that was a model I had used in other hospitals as well, and we continue to use that model today. Retention, definitely. As I described some of this work, when I first entered this organization, we had a lot of turnover, as many hospitals did around the country. I'm going to tell you numbers that were pretty high, sometimes between 20 and 35%. I would say today our average turnover, and this matches what I see from the Presbyterian organization and NDNQI data, it runs an average of about 16%. Do we have a goal to get it down to pre-pandemic levels? Of course, but I'm actually pretty happy right now that it's staying pretty steady at 16%. And even one lagging organization that was struggling, that had, a lot of other different issues, is now down to like 21%. Yeah, actually, I think they were even 19 when I looked at it recently. So it's all coming in line. Now, I'm a realist. There's still lots of issues for nursing across the nation, and each generation has different needs that you need to understand. I really think nurse retention is one of the most important things we have to continue to pay attention to post-pandemic and going forward. Our nurses are really a valuable part of our health system. They're the backbone of healthcare, especially in acute care. They have 24/7, 365 responsibility. And when nurses are at their best, we are that thread that just pulls together the entire healthcare team and really helps to make sure that there's synergy in how we work together as a team in caring for patients. As a nurse leader, I don't believe I can ever take my eye off retention. There's so many dynamics in healthcare today that is one of the top priorities in my role as a chief nurse. I need to look at the work environment. I need to look at the dynamics of what are happening in the hospital, keep an eye on compensation, make sure roles are clear, make sure resources are in the hands of our nurses in order to care for patients. When I look at the role of technology in nursing practice, that's actually one of the main priorities in how we drive retention. How do we decrease administrative burden and charting? I am on a roll to make sure we get voice activated charting or some sort of ambient listening going forward.
Oh my, preach. It sounds amazing already.
So as I work with our technology team on things that can help nurses have more efficiency, but also optimize how they provide care each day, that would be a really big win when I get to be able to pull that off sometime in the near future. I'll continue to watch other organizations that have already achieved that and learn from them as well as I go forward. But it takes many different levers to be able to address the different needs of the different generations in our workforce. I mean, I believe we have about 5 generations right now at the bedside caring for patients. And those personas, understanding those personas of what those nurses need is important. And it's definitely not a cookbook solution on how to lead the retention. Actually, we had a lovely presentation by Rose Sherman at our summit yesterday. I think she's an amazing thought leader in the nursing world and just really has many practical solutions and is really able to speak to the reality of what's happening in health systems today. And she did emphasize you really need to understand the different generations, not as a label, but as a lens to understand what the nurses need and to understand there is this shift happening in the workforce about how people perceive their careers. Fortunately, nursing careers are perceived as really good, sustainable career options. So I think that's a win. At the same time, the need for people to balance work and life, being able to make sure that we have ways through flexible scheduling and other opportunities that way for people to be able to blend work and life are equally as important.
Holly, this project is like, I'm speechless. Like the magnitude of this project and how this worked at the system level is just nothing short of amazing. But what sticks in my head the most is that how you've lived and implemented probably almost every one of the healthy work environment standards. And the one that really comes to mind for me is, your authentic leadership, the collaboration between your leaders and the staff, which I really think develops trust, effective decision-making, communication. I mean, I think that you've wrapped this all up in a nice bow. And although nothing is ever perfect, it sounds like you've made amazing strides. And what I'm curious about is, sometimes the initial excitement can wear off. How have you sustained this over the course of 3 years? And the one thing I really want to know is how did you engage the off shifts?
I think that's a great question. Sustainment is super important, and I really credit the Nursing Leadership Council process as one of the main drivers in that sustainment. When I am in that meeting, virtually or in person with the team, I am seeking the voice of the nurse throughout all the different topics and discussions that happen. So even if some of my direct care nurses are virtually online because they might have worked the night shift before, right? I give them that flexibility to be there in person or virtually because they are on different shifts. If I was to mandate they were all there in person all of the time, that is unrealistic when you're trying to support direct care nurses to engage in this work. So as I go through the meeting, I am making sure that they all get an opportunity to share their thoughts, their ideas about whatever subject that we're talking about. The sustainment also has to be nurtured over time. So after they were participating in the Nursing Leadership Council, about 6 months in, I went back to every single one of them in person and said, tell me about what your experience has been like so far on the Nursing Leadership Council, and just left it open. And then started a conversation with them to identify, do they feel like their voice is heard? Do they feel like we are working on topics that matter? Are we trying to address the right problems? Are we trying to find the right solutions? Are we doing the work in the right way? And then are they feeling that there is value, right? So not only are we having conversations, is it now translating in results that they can take back to the bedside? Because it is their accountability after each meeting to take the content and the information that we discussed, go back to their site-specific unit councils and their hospital practice councils and say, hey, this is what happened at the Nursing Leadership Council. This is how it connects to our work here. Now let's figure out how we can align that. Or at the same time, we get feedback from their direct care nurse peers and then come back and bring that back to the council at the next meeting. But I did this 6-month check-in as one of the many steps to make sure that I was really listening and understanding what their experience was. If there is a meeting where they're a little quiet or not, maybe a little bit more reserved, I, in a safe way, say, hey, Andrea, what do you think about that topic, right? And be able to make sure that they feel permission. I don't need to do that anymore. They are fully engaged. They understanding of their permission, and I rarely have to prompt them anymore. At the unit level, when I round at the hospitals and the clinics, I always also personally check in with those nurses. I find out if they're on duty, and I go and I check in with them face to face when I round at their hospitals as well. I think in summary, in order to have sustainment with this work, one, you've got to be on the ground, rounding, being visible, staying in touch with the reality of what's happening in their world, at their location, rounding on patients to assess whether the environment is shifting and changing in the eyes of patients. And then also checking in with their leaders. Do their leaders feel like they have the support they need to continue to nurture the direct care nurses' engagement and involvement? I think what I would add to that as well is we also just started turning back on other successful programs that had also died with the pandemic. We reactivated the entire DAISY recognition program. And that is alive and well in all the hospitals and clinics, to the point now it's a competition on who can have the best celebration. At our nursing annual Nurses Week celebration, we did the first ever team award for DAISY. So that became part of the big live celebration where we were able to recognize 2 teams for their excellence through and use the DAISY Team Award to recognize them. And we even had Bonnie Barnes virtually available to be able to also witness that and engage in that celebration with us. We turned back on our application process for the AACM Beacon Excellence Awards and just submitted 2 applications. Now, I'm going to share with you, I don't know what the outcome of that's going to be. It's our first engagement again in a very long time with that. And having done that work at other organizations, I appreciate the complexity and the rigor that is excellent about that process. But the first thing is we at least did it and submitted them. Or through AONL, we submitted, I think we put in 9 abstracts to be considered for the next AONL conference. It's constant small doses of action in leading nursing excellence, always with the direct care nurses involved, so that they can see the results of their effort, right? And then at the same time, going to the sites and seeing what they're proud of what they're accomplishing at the unit level. I'm sure many people on the call go, oh my gosh, how do I keep my council alive? What do I do? You just start. Just even if it's only 3 people who are starting it, just get started and then keep on going. And as you create positive results for the experience of the nurse and positive results for how we care for patients, it starts to build momentum. As you're going through that process, you have to nurture it. And not just myself, but my leaders, like, we have to be visible and show up and show interest in these things, and be part of that process as well.
You've mentioned so many outcomes that have been accomplished with all of the work that you have done. Like, what is your top, your number one that you're like, I did it. I achieved this. I led the people.
Well, considering what we had to build, having the direct care nurses on the Nursing Leadership Council, and that is a sustainable process that people are excited about, is a really big win that I'm still celebrating, because without that, we can't make all these wonderful ideas happen. Yesterday at this summit that I've talked about a couple of times, there was a nurse leader that was attending the session, but it was the first time she was at that summit and got to also meet and see what the Nursing Leadership Council was doing. And she shared with me, I really love this. I want to be part of this. How can I be part of the Nursing Leadership Council, right? So it's just role modeling it, letting people see what the opportunities are, and going from there. This is where you just have to keep finding ways to invest in your nurses and keep building momentum. The Health Management Academy has a Nurse Catalyst program. We graduated 5 nurses from that program in June for the first time, and we just started a brand new cohort for the following year of 6 nurse leaders. At the end of this summit, we had the alumni from the first cohort and the new enrollees in this new cohort, all on stage in front of everyone attending the summit yesterday. And they shared their experience of going through orientation and what they were most excited about and what they thought the project is that they wanted to work on to improve practice and care. And then the alumni were there in order to be able to share what their experience was, the projects that they implemented. It's just, no matter what example you use, you just have to keep creating opportunities that invest in nurses in their development so they can affect practice and patient care, and not just do like one every 2 years. You need to constantly, you're either submitting a poster presentation, or you're having a summit, or you're together at Nursing Leadership Council trying to solve important problems, or you just enrolled people in a Catalyst program. But then you're in the hospitals, in the clinics, being able to see the results of that work affect the culture as well. So I would just say it's this continuous process improvement effort to be able to invest in people and make sure that it produces results and change.
I just am amazed. Again, I know I said that before, but I'm just amazed at everything that you've been able to accomplish in really a short amount of time. I know 3 years seems like a lot, but we all know how long it takes to accomplish one project. So the fact that you've done all of this is just fantastic. And, I loved what you said about how somebody was able to come to the summit yesterday and it was their first time and they want to be there and do more. And I just think that speaks to how much positivity is contagious and engagement becomes contagious. And if you continue to focus on all that positive, how much that's going to bloom and blossom and continue to spread throughout your system, which is really fantastic. So kudos to you and all of the direct care nurses in your system, because they don't realize the opportunities that they've been given by being able to have their voice. So I hope others on this who are listening to this podcast can learn from it and realize that it's possible. But that being said, I understand that your system is now going to be participating or is already participating in the AACN's Clinical Scene Investigation Academy, or CSI for short. And that your system was also a recipient of some funding through the Nursing Workforce Solution Program with Johnson & Johnson, and the focus would be healthy work environment and the nursing workforce. So I don't know if it's too early, but can you share a little bit about what your teams will be working on?
Yes, I am so excited to be able to participate in this program and to have Presbyterian Healthcare Services engage in this wonderful opportunity. We actually launch in October, but we've already done a lot of the preliminary work on setting up our teams and defining what our projects are. We have 10 teams established. These teams are primarily going to be led by direct care nurses. We have educators enrolled as coaches and support, as well as leaders. And I do have a wonderful colleague that I work with. She is an executive director of nursing excellence, and I've given her the opportunity to be able to help coordinate this at the Presbyterian level. When I think about the possibilities of this work, there's two things that I'll share. As I mentioned earlier, one of our strategic pillars was community engagement. And when I think about this state of New Mexico, it is a very rural population. We have a large Native American population. So all of you as nurses understand what the social determinants of health can look like in this environment. I already know from looking at some of the ideas for the projects that we have nurses that are looking at how do we improve the social determinants of health? How do we really make sure that our work will also help some of the main population of this state and be able to really make a difference? How this connects to professional governance is one of my chief nurses who has led this initiative on community engagement beautifully actually created a committee within her community engagement work that is led by direct care nurses in order to directly make sure that they were defining what does it mean to do a better job in engaging the community in the care that we provide. So I'm expecting to see some really good work to come out of that as well. And then once again, the summit that I talked about as we developed the 2026 Nursing Strategic Plan for Quality, Safety, and Care Experience, there were nurses in the room that are now refining their project ideas for this AACN opportunity. And they were getting additional ideas as we were actually building the strategic plan together. So I think what I'm going to say is there's no shortage of ideas. And now we just have to triage them and prioritize them and make sure that it also aligns with the goals of the program. But at the end of the day, this program has created additional excitement, and it keeps sending the message, nurses matter. Your ideas matter. Your voice matters. And we're not going to do this work without you. We're going to do this work together. So once again, I don't believe any of us have arrived. I think this is a journey we have to continue to nurture, but I couldn't be more excited about the seeds that have been planted and the individuals that have come forward where they are inspired and engaged and putting their fingerprints on this work. So I'm excited about where we'll go next with these ideas.
Holly, thank you so much for sharing all of the amazing work that you and your team are doing. And it's really been a pleasure spending time with you today and learning about about everything that you have all done. I think you've really empowered direct care nurses to make meaningful contributions to the community, their patients. And so we really thank you for giving your time today. I know you're very busy. So again, thank you.
Well, thank you so much, and I appreciate this organization's investment in nurses as well. And I'm appreciative of the opportunity to share some thoughts on that today. Thank you.
Thank you to our listeners for joining us today. We would love to hear your feedback on this episode and any ideas for future episodes. Please send your feedback to podcasts@aacn.org.
Thank you for listening to the American Association of Critical Care Nurses Voices in Nursing podcast, proudly sponsored by AACN's Clinical Scene Investigator Academy, providing the knowledge, skills, and tools to lead innovation, with information available at www.aacn.org/CSIAACN.